Dr. Cassi from NAVC's VetFolio and the host of Vet2Vet. One of the most complex conversations we have to have with clients is deciding on a treatment plan. Taking into account all the factors, including what's best for the pet, what's best for the family, it's as much of an art as it is a science. Today we're talking with Dr. Tracey Deiss, and owing to a vast and varied career, including experience in small animal surgery and emergency medicine, Dr. Deiss has become a skilled communicator in even the most difficult of situations. Dr. Deiss, there's nothing like the tough conversations you have to have as an emergency vet to really teach you that clear, empathetic communication. Am I right?
You are so right. And with that, I think just the further along we get in practicing those conversations, the more confidence we have in delivering those messages.
Absolutely, absolutely. And it never hurts to have kind of some tips and tricks along the way.
Tips and tricks is how we survive our days, Dr. Cassie.
Yes, absolutely, absolutely. Well, it's easy to kind of get, stuck in our ways when we're practicing medicine. The old, I always treat X with Y type of mentality. And it's worked for me up to this point. But, like we talked about that conversation, medicine is just as much of an art, requiring us to get creative, as well as use our scientific brain. So can you give us your perspective on why it's important to avoid, sort of knee-jerk prescribing habits?
Yes. We are in a service industry and a service industry that has undergone a lot of change recently. And that's not just with what we do, it's the world in general. So I think it's important that we intermittently just take that pulse on what is driving our diagnostic, our treatment plans, and our prescribing habits. And we want to pause to make sure that what we are doing and our behaviors align with what the pet owner wants so that we really avoid those assumption biases when we're making those recommendations. We want to be sensitive with budgets and we want to consider cost, but we want to really avoid making those cost-based recommendations because when we really drill down to it, cost and value are beasts of a different nature, not just for us, but our pet owners as well.
Absolutely. And I love that you brought up being sensitive to this because there's a fine line between being sensitive and kind of directing in a certain way. We've been told over and over again, don't assume the client's budget. Don't assume whether or not they want to treat or how they want to treat, which is a very valid thing. People should definitely be able to make their own decision for their pet and have all the information to do that. And I think a lot of us try to keep this in mind when we're recommending treatment plans. But can you talk about some of the subtle ways we might be directing the client in one way or another, maybe without even knowing it?
You bet. And you're right. It is ingrained in us, right? From the time we graduate vet school to approach every case with an open mind, craft those plans for each pet without biases. But then sometimes everything we know because of circumstances, it just goes out the window. So for me, I'm going to say, it's going to be a moment of transparency. Those biases are not typically client or pet related for me. For me, a trigger would be the kind of day or week I'm having. I will often craft a plan, make a recommendation based on what I perceive is the path of least resistance, right? I don't want to grovel. I don't want to argue. I don't want to defend why I want to do what I want to do. So I just take the easy way out. But for many of us, I think it might be that we walk in and we see a giant breed dog, or we notice that the client's acceptance in times past maybe hasn't been what we want it to be. And we use all of that information to create prescription or diagnosis biases. And sometimes we'll offer our pet owners something opposite of what we would want for our own pets, right?
Yes, it's very true. And Yeah, and you're right. Like we just don't know because those thoughts kind of go through your head. I love that you brought up the giant breed dog because I
Mhm.
will say that is something that I think will influence my recommendations, even with the best of intentions for it not to. Because you know it's gonna get expensive and
Mhm.
it does kind of play into that path of least resistance where you're like, then we're gonna give them this price and their head's gonna explode and I don't and then I'm not gonna get anything done and we've already got ourselves all the way down this road of what's going to happen before we've even offered any recommendations.
Yes, and that comes across when we are making our recommendations that we've made that movie in our minds. And so then we go in to present the plan, maybe go over the estimate, and our confidence is just, is terrible because we've already talked ourselves out of the plan that we honestly believe in.
Sure, we've already, and then we're directing with our voices, with our body language and our interactions in, very subconscious ways.
Absolutely. We put emotion into it instead of just remaining objective.
Yeah, so let's talk about it. If we can do this in a very productive way where we're not letting these biases play in, what does the data say about our interactions with pet owners and their decision-making process?
Okay, so what the data says, and the data that we're going to be talking about is DMR Harris Poll willingness to pay. So this is research just looking at pet owners' perceptions on why they choose what they choose. So the number one influencer on a treatment option choice is the vet's recommendation. They care about what we offer. 47% of pet owners are going to pick what their vet recommends. The second option with 28, weighing at 28% is what's best for their dog. What's the best option? 14% said what's the best option for my lifestyle. And then only 5% weighed in with cost being an influencing factor. Now, in the vet's recommendation, safety and efficacy was included in there. I know those are very important things. And so I just want to mention that pet owners perceive whatever we recommend to be safe and to be effective. Now, on the flip side, let's look at what vets say are their top influencers. And this is going to be a different poll. This is going to be looking at brand equity in the realm of anti infectives, like an anti infective diary. So when we asked our peoples, what is the most important thing when you are crafting a treatment plan? Here's what we had to say: first time treatment success, right? We want our patients to get better. We want their pet owners to be happy. We are happy when our pets and their people are healed, right? Second was speed of onset. Third, safety efficacy. Formulation, ease of administration, weighed in at 4 and 5. And what didn't make our list was cost. That's funny to me because it didn't make our list, but yet it's one of our main drivers when we're crafting a plan. So when we look at what's important to our pet owners and we compare it what's important to us, cost wasn't even in the top three, but yet we lead with it often.
So, when we're making these recommendations, knowing how much weight our recommendation carries, what are some of the important concepts we should keep in mind when we're choosing a treatment plan for a patient?
Such a great question. And may I have a moment of vulnerability and transparency here, Dr. Cassie?
Of course, that's what we're here for. That's what makes these videos so special.
So fun. If anyone can learn from my past mistakes and misery, it makes me happy to do that. So, important concept. So, at Zoetis, we came up with this acronym known as PAWs. Now, before we get to pause, I'm going to share the why behind it. So in practice, I like to pride myself as not having treatment prescribing biases at all. But on a particular day, I was seeing one of my favorite patients whose name is Sugar Bear. Sugar Bear is a 169-pound Great Dane. She and her brother Tank are lovely, lovely Danes. They have a great pet owner and a pet owner that understands and budgets for having a giant breed dog, although we do try to stay sensitive. So on a given day, I diagnosed Sugar Bear with diffuse pyoderma. Culture and sensitivity gave me the list of what antimicrobials I should reach for. And I went in, I presented a treatment plan. Now, injectables are my absolute faves, but do you think I put an injectable on there for a 169-pound dog? I didn't. And my heart literally sank to my tummy when Sugar Bear's owner asked about injectable and asked about convenia specifically for Sugar Bear's bacterial skin infection. See, Sugar Bear became Sour Bear anytime mom tried to administer oral meds, and it was very disruptive to their relationship. So she asked for it, and at the end of the day, we were able to provide her with that injectable solution. So with Sugar Bear in mind, we came up with the PAW acronym. It's so lovely. It's simple. It can work with every single pet owner and patient every time we need to craft a plan. P stands for pillability. Does this pet take meds easy? Is it difficult? Is it a fight to get meds in? Is there already caregiver burden, whether with this pet or another pet at home, that would make giving a pill difficult? A is going to be adherence. The synonym to adherence is compliance. Wah, wah. I know we all get tired of talking about it, but it's so important. And what I find is in sharing with my pet owners, hey, I love my fur family. I'm terrible at compliance, and giving pills and being able to adhere to a schedule is not proportionate to love. So tell me what you can do. Honestly, they tell the truth. They tell me what they can do. And then we craft a plan based on their ability to adhere. And then W is what's the solution now? This reminds us to set the expectation. Do they want to see treatment success and results in a day, a week, a month? Because if we don't know what they are expecting, we are setting ourselves up for a perceived treatment failure. So pause to paw each time, it'll work.
So easy to remember, too.
And so cute.
Well, so of course, this brings into account how we discuss prices and treatment plans with owners. So I'd love to know your opinion. What's the most effective strategy for presenting an estimate to an owner? Should it be done by the veterinarian? Should it be done by a technician or another member of the support staff? What's your opinion on that one?
Yeah, I love this question because I don't think it's so much the who, it is the what and the how. Because anyone that delivers an estimate, the level of confidence and their buy-in and belief in what they are recommending is really what is the key to success. I have had members of my vet health team, from the CSRs to one of my technicians to even some of my kennel assistants, that just do this with confidence and grace. And we talked about it earlier, Cassie, that objectivity. We want to take emotions out of our recommendations as best we can, and we just need to be objective about it. We need to say, hey, this is what is recommended. And then we stop talking. So many times we talk ourselves out of our own recommendations because of our verbal or nonverbal communication. So circling back, rather than the who, it's going to be the what and the how for me.
Okay, that makes sense. And I'd love to dive into that a little bit more. Can you kind of give us an example with taking that emotion out of it and that stopping talking at the end, because that's something I know I struggle with personally, because a lot of times these are emotional cases, especially if we have, bigger estimates and things like that. How do you kind of have that internal dialogue with yourself of, okay, make the recommendation and then let them make the decision?
Yeah. So I don't have to have the inner dialogue as much as I used to back in the day when I was first having these conversations. I'm sure my vet health team members do. So beyond the internal dialogue, this is probably going to make many of our viewers just cringe. We practice with one another. We do. We role play it. So we want to be empathetic without being overly emotional. And what I mean by overly emotional, I don't mean, out of touch with the situation. We identify with our pet owners. We connect with them. We're here because of them. They are the liaison between our patients. So being empathetic is so important. However, in our empathy, we cannot put a bias on the value of a treatment. Notice I said value, not cost. Because if I recommend something, if I have a recommendation and I assign a nice value, the conversation isn't going to be about the price point. It's going to be the why behind the value. When we relay the value, our pet owners can more easily understand the cost and will make more effort to budget for it. Did that answer your question?
That did answer my question. And I love the focus on empathy, that we're not losing that empathy. We're not disconnecting here. We're staying connected. Although you did get the cringe from me about the role playing. You were right, where I went, oh gosh, role playing.
Oh, I used to dislike role playing, but one time someone asked me, and it was a mentor of mine in practice, said, a lot of times we think we can deliver a message a certain way, but then when you video yourself and watch it, you learn that you just missed the mark. So I started doing that and I realized, oh my goodness, what my brain thinks I'm saying and what my mouth thinks I'm, is saying, there's a disconnect there. And so there's so much value in just making sure that our brain speech connection, they're paralleling one another.
I think that makes a lot of sense. I will say there are
Mm.
few things more humbling than spending part of your career with a microphone and or camera on you. You learn a lot about your own communication.
You do.
Well, so I'm thinking of say like you or I who've watched ourselves on camera and understand our communication style, and then also have that DVM degree where sometimes we can see things from this 50,000 foot viewpoint when we're making recommendations and explaining the value. But what if we're talking about some of our other team members? Maybe we have a new technician or CSR. How do we empower our technicians and other team members when presenting prices to the client? It seems like training with respect to why the different parts of treatment plans are important and how to discuss them with clients would be incredibly important in these scenarios.
Absolutely. And it's always best to draw from personal experience. So, say our vet health team member is going to be a technician for us, one of our technicians that's going to go into the room. We want to channel any likeness to that case to one of their own pets. Has their own pet undergone this diagnosis, this treatment plan? What were their thoughts on it? Because when we can get their buy-in and their belief, oh, they light up when they have the opportunity to share their experience and its connection with the pet owner. So that's the first thing I encourage is let's draw from a personal experience. And then if we can't, another great thing is to draw from what they know to be true about us and what we want to do for our patients and pet owners. An example of that might be I can have a vet health team member that maybe we just began working together, but my hope would be that they would see my passion in wanting to make a pet better, I would hope they would see my passion and be able to go in and deliver that estimate with what I call borrowed confidence, right? So go in and just say, this is what Dr. Deiss recommends. I know that she believes in this because of XYZ. I know she wants Fluffy to get well fast. And I know that she's sensitive to your budget because in getting resolution, we'll save money with prolonged need for therapy, a lot of rechecks. At the end of the day, she's asking for a big commitment, but this is going to be best for the budget in the long run.
I love that borrowed confidence because that is so important for all of us when we're starting out in our careers. And also, even if we've been doing this for a while, maybe there's some things that we're not, we haven't done a whole lot, don't have a lot of experience with. And sometimes we need that borrowed confidence from our team members.
Absolutely. We all have those ambassadors. Everyone in our practice is just an ambassador and just a bad A with a certain topic. And we have to remember to channel all that energy and tap into those ambassadors.
Absolutely. And this brings up another important topic, which is pricing. I feel so passionately about how important it is that we all understand, all the team members understand pricing and why different items and different services are priced the way that they are, because otherwise it can be so tempting to devalue them just subconsciously, not even realizing you're doing it. Can you touch on some of the important concepts to keep in mind when we're creating a price and maybe even how to talk to our team members about pricing?
Yeah, you bet. So this is it's a big conversation. We probably have a video cast just on pricing, but we know there's several pricing models. There is the markup where there's just a flat, we're going to mark it up 2 times, 3 times, whatever. There is margin, which is going to be a staggered pricing point. And then there's a hybrid between the two. And why looking at how we are setting our prices, why it's important is we want to try to be equal opportunity pricers. Now, what that means, let's look at our injectables. Injectables really aren't part of the pharmacy. They're part of our service bank, right? They're part of our service bank. And historically, when we look at the price point between littles and bigs, when I say littles, I'm talking about those less than 50 pounds. When I talk about bigs, it's going to be those over. But a lot of times our marking strategy, our pricing strategy is fine for our littles, but then we set price points that are going to be maybe unattainable for our bigs, our owners of the bigs. So by maybe amending just flat markups, by amending and doing a hybrid or margin pricing, our littles might have to pay a little more, but it's still very reasonable and affordable, especially because it's a value, it's a service. And it brings that price point just a little bit down for our bigs so that we can offer those injectable solutions to all of our patients independent of size.
Gosh, that's such a good explanation of, how to be conscious of all of this. And, I think a good talk to have with team members of, when we're pricing these a certain way, it's so that we're helping to make it affordable for everybody.
Absolutely. And then, circling back to what we talked about earlier is remember our treatment is only as good as its success. So say I have an injectable solution or I have an oral solution. If that oral solution doesn't actually get into my patient in the long run, that is going to be a treatment that's going to cost more because they're going to come back for rechecks. I might need to repeat diagnostics. I might have to do, like in the case of bacterial skin infections, I might have to then do a culture and sensitivity. So we have to factor all of that in. The number we see on an estimate, it's just a number. It's not reflective of the value.
Such a good point. I will talk to owners about that from time to time and say, the most successful medication is the one that's going to get into your pet.
Get into the pet. So in my world, I already shared this with you. It's going to be an injectable as much as I can because I'm just the worst.
Yeah, there you go. I mean, but it's good to know that. I would say I can absolutely relate to that. And then also, I mean, even for my patients, it's not only like personal compliance. Sometimes it's just that peace of mind where you're like, I know that you have the medication you need on board.
I know. And there's that temptation. I so wish that I weren't guilty of this, which I think will probably be a great segue into another topic that we're going to cover today is I'm so guilty at having a few pills left in the vial
Sure.
with when it comes to antimicrobials. I just have to save me from myself because I want to be a better steward of antibiotic usage.
Absolutely. Absolutely. So many important considerations to keep in mind. So, when we're talking about injectables, sometimes there can be a higher price point, especially with owners of large breed dogs. So, do you have any tips, any strategies that you feel are particularly successful when you're going over these prices and these treatment plans with pet owners?
Yeah, so I think, of course, always starting with pause, right? Pause to paw, and talking with them. And Can we talk about? Because I think it's easier to use like an example as we work through this. So can we maybe talk about bacterial skin infections? We can talk about that.
Sure. Yeah.
Okay, great. So say I have diagnosed pyoderma, and it's pyoderma that is warranting systemic antibiotic. Again, I want to be a good steward of antimicrobial usage. So say a canine patient, a big, has a pyoderma that is warranted with systemic antibiotics. I know that for the organisms that we need to target, most of the time it's going to require a time dependent antibiotic, right? So we want an antibiotic that's just going to stay above that MIC. That's going to be that lowest number, the minimum inhibitory concentration to kill that bacteria. But remember, we have to stay above that, right? We have to stay above it consistently. And the more we dip down below what that targeted MIC, the more we're going to set up for not only having treatment failure, but the more we risk being poor stewards of antibiotic usage and promoting selection of resistance. So typically I go in and I just say that. Now, I'm not going to go through what an MIC is. I literally am going to draw a line on a paper. I'm going to say, hey, this line represents this number that we need to be at to kill the bacteria that is affecting your dog. We have to do it. If we don't stay above this number, we're not going to have treatment success. So I sit there and I tell them, okay, if I can give you this injection, and look, it is going to stay above the number for 7 to 14 days, right? Because that's dependent. In the case of convenia for bacterial skin infections, it's depending on what we are treating as to how long it lasts. So, okay, this is going to do it for you. Great. And then we're going to do some rechecks. We're going to have some touch points in there. Going to get you back in 2 weeks, do a recheck, going to retape, make sure I'm seeing what I like. I could do once daily, and here's what that looks like. I'm going to show them how I'm going to go above that MIC, but then it's going to drop down. And then I'm going to go to option 3 and show what they're going to need to do. When I map that out, and then I show them, this is what it's going to cost if we don't have success. Here's going to be the rechecks. By the time I add up all the stuff that is going to happen if we don't have success, I'm at the price point of convenia. So when I go in and do that, I have a pretty good success rate, independent of the size of the dog.
And I feel like time-dependent antibiotics are such a good example because, we're talking about did we give the meds? Are there meds left over at the end that maybe we forgot a dose here and there? Also thinking about time-dependent, sometimes those have to be given several times throughout the day, which can be challenging. Yep. And then also, if I give it when I wake up and then I give it when I go to bed, those aren't always 12 hours apart and we've got some variability. So that's such a good example.
Yeah, it's a time when good might not be good enough, right?
Sure, absolutely. Well, Dr. Deiss, it's always a pleasure talking to you. I love talking to you, especially about client communication. You have so many just wonderful pearls and are so warm that I can only imagine clients just absolutely love coming to see you. So thank you so much for joining me today and having this discussion.
Thank you, and happy to come back anytime. It's always a pleasure, Dr. Cassi.
And thank you to Zoetis for partnering with us for this edition of Vet2Vet. Check out NAVC's VetFolio.com for more of our B2B discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day. Important safety information for Convenia. People with known hypersensitivity to penicillin or cephalosporins should avoid exposure to Convenia. Do not use in animals with a history of allergic reactions to penicillins or cephalosporins. Side effects for both dogs and cats include vomiting, diarrhea, decreased appetite and anorexia, and lethargy. See full prescribing information at conveniapi.com. That's CONVENIAPI.com.